What about laser? Where does laser fit into this spectrum of different treatment modalities?
Laser would probably can help again.
Yeah? It's a light-based treatment?
But probably a bit more...
More invasive.
Yeah, you won't be able to go out for dinner that night, let's put
Agreed.
it this way.
And whilst the LED offers a spectrum of different wavelengths of light, laser just focuses on one wavelength of light. So it's maybe more targeted, maybe more selective, but it's really kind of just doing one thing rather than an overall effect.
Maybe an overall, yeah. But also, I mean, with the LED light, it doesn't create any heat in the skin.
So the damage, the collateral damage is minimal.
There's none.
That is too good.
It is. We do like it. And we have used it pre and post-op as well to help with
Minimising scars as well.
And perhaps even speed up the healing process. What other ingredients should we be looking for? So we spoke about, just to recap, we spoke about some AHAs and BHAs.
Let's just run through some names there, common names.
So in the past, glycolic acid has been used a lot because the key was let's exfoliate and resurface the skin. As well as a little bit irritating. That's quite irritating.
So that's an AHA.
It can be over-drying.
Over-drying, yeah.
Lactic acid is an AHA.
Yeah.
Chlorogenic acid.
Yeah.
As well. Mandelic acid.
Mandelic. Is that from apples?
Almonds.
Almonds.
Mandelic is apple or almond?
Well, I have to look that up. I'm not sure.
You it's just got me. Mandelic.
It's from nature. That's the most important thing.
Well, they're all from nature.
They're
called fruit acids because they are from fruit.
I like
and
lactic
milk.
acid. It comes from milk. Isn't that cool? And what about...
And it exists in our body. It helps
Cleopatra.
with our...
What did she used to use?
That's right. She used to have...
Was it lactic acid?
Milk.
And it may have been Josephine. Napoleon and Josephine, who used off wine.
Did he?
Yeah, the acid's in wine. But we're saying we're not drinking too much wine.
It's okay, you can apply it on your skin if you think it would.
Not vinegar.
No.
That's too toxic.
So what is it? It's the acidity in the product.
Acidity. I guess it's the acidity in all of these things.
That's right.
But with the fruit acids, they're not burning acidity, not burning level pH.
No.
But just enough to stimulate and to exfoliate and to reawaken.
Yeah.
Yeah.
So we cover that. Then we've mentioned some antioxidants.
Mm-hmm.
They are very important in this environment that we live, whether it's stress and toxins and pollution and sun and smoking and...
Do you have a favorite group of antioxidants?
Look, vitamin A, C, and E as a combination of vitamins because they really help to protect the skin cell in on all fronts.
Yeah.
And so together they work very well. But there's a whole lot of others that we eat and drink, like blueberries and pomegranates, and so they use them. They use them as well. They're ingredients.
A secret love of mine. But it's hard to get those little seeds out.
It's good. Jewish New Year's is coming up. James will get you some pomegranates.
Is that right? Is that part of Jewish New Year?
Yes.
Get out of town. Yes. I love that. I love that. And what else do we know? Vitamin A. Have we talked enough about that?
We didn't really. We've mentioned a little bit.
We've touched upon it, but...
So what is vitamin A good for, really? It's for cell metabolism.
Cell metabolism.
Renewal, resurfacing.
It can be a little bit irritating when you first introduce it.
Yep.
So you want to go slow and then just build it gradually.
But we also mentioned there's different
classes.
And different classes, right?
Yeah.
So a lot of products can claim that they have vitamin A, but really at what degree and how much change will they cause?
What percentage and how active is it? By all means, you can ask any of us here in the clinic and we can direct you towards things that are more effective, because there's nothing worse than spending money on something that ultimately it's not doing the job it's advertised to do.
No, and we want to build up slowly and gently introduce ingredients to the skin if you've never used them before.
Yeah.
It's always wise to just slowly introduce, no matter how fantastic this product can be.
Tippy-toe, little steps, and just slowly introduce the next thing and the next thing, because you don't want to bombard the skin. It gets confused. and then it flares
and then
up.
we'll have a reverse effect.
And then everyone says, hey, that didn't work, I got redness, I got acne, I got this, that and the other thing, but you probably tried too much too soon. So just ease into
That's a common problem. A lot of people get excited and get heavy-handed.
A little bit's good,
yes.
a lot must be better, and I want to be looking that good yesterday, so bring it on. It's too much.
No, we don't want to do that. What else do we need to cover, James? Does anyone have any questions?
Yeah, we're here to answer whatever questions that may come up. So in the context of the clinic, there's a whole lot of stuff that we do in addition to these things, in addition to these treatments that we talked about. We're really just focusing on the skin today. Mm-hmm. We haven't talked about Botox or fillers, which are available here. Mm-hmm. The way I think about those is they make improvements in the skin, but it's an indirect improvement. So a Botox will even out early wrinkles, so wrinkles
expression
lines, that's right. So the ones that are active, that are there when you smile or there when you squint, they will be ironed out. The ones that are permanently there, they're not completely disappeared. They will be there to some degree. But it's not actually working on the skin, it's working on the muscle under the skin. So indirectly, it's improving the way the skin looks, sure, but
we still need to take care of our skin's health.
Absolutely. Skin comes first and foremost, and then, like we're layering the introduction of ingredients to the skin, we layer the treatment. You can't just throw everything at something all at once. You just want to tiptoe in and get a base level happening, and then the next thing, and then you start looking amazing before you know it.
So tell us, James, what is the difference between fillers and Botox?
Botox, it's a naturally derived product, but it's derived from a bacteria originally. It's a neurotoxin. Terrible word, sounds horrible, but what it does is it just puts the muscles to sleep. What I tell patients is it's like going out of the house and you're turning off the lights as you go, flick, flick, flick with the switches, and the muscle just slowly goes to sleep. And then as the muscle effect starts coming back to life, it's like coming back into the house and turning on the switches. Flick, 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 so the animation lines, the smile lines come back to life. So really that's how the Botox works. The fillers are aimed at replenishing a loss of volume. So as part of the aging process, if we take it down deeper from the skin and down into the underlying structures.
Would they be hyaluronic acid mostly? Or?
Yeah, they mostly are. Well, in fact, you can think about them as ones that are reversible or ones that are degrade naturally in the body, and then you have ones that are permanent.
Right.
The permanent ones, if you get problems with them, they're really tough to deal with. So hyaluronic acid is by far and away, in my opinion, the best. Okay. So yes, we're putting the hyaluronic acid back into the body, so it's a naturally occurring substance, although sure it's produced in the laboratory, but it's still recognised by the body as being natural, and therefore it doesn't cause any ongoing problems.
Yes, that sounds pretty good.
Yeah.
But as far as, just quickly, because this is something we probably should leave for Lisa, but you have done that before, where would you use Botox as opposed to fillers?
So it's sort of an easy way to think about it is above the eyes is safe for Botox. Below the eyes, it's kind of expert area. Lisa's fantastic at that, but you can cause problems that you don't want to cause using that treatment when you're going below the eyes. So go with someone who knows what they're doing, go with someone you trust, go with someone who's done it before, either for you or your friends, or that you know is a good person, good at using the product. As for the fillers, once again, this is Lisa's area, but, you know, used judiciously in areas of deficiency, they produce a beautiful, natural, lovely effect and complement what we're doing at the skin level.
So, James, you're a plastic surgeon. Can we ask you quickly? So
100%.
When is the next step, or what are you looking for with people's health in order to recommend a surgery, or when they're starting their queries into that?
I think that is a really good question. It's a tough one to answer. So there's different time points in everyone's life, and they may seek out a plastic surgeon or not at different times. So it might be right time for you at the age of 20, it might not be right for you until you're 50, and you might be completely fine but decide to approach someone like myself at 65, 70, whatever that is. So at different times, my skill set is called upon and is better employed or better not employed. And I think for me, that's the real art of plastic surgery, is not having a broad brushstroke approach to everyone, but saying, you look great now and you'll be better served looking after your skin, or let's try a few non-invasive treatments. Save that surgery for another day, because it's really, you don't want to start down that path too soon. You're not ready, or you look great, let's try this first.
And definitely try to promote skin's health before looking for that quick solution and pull the skin to make it look tight, because it would still
doesn't work.
Fail if it's not healthy, right?
That's 100% right. It makes my job ultimately a lot easier. And more fulfilling, because the patient feels like they own part of the process. They're at home looking after their skin. They've modified their environmental factors at home that they can change. They're getting more sleep. They're looking after themselves. The sun protection. They're using cosmeceutical grade skin products.
That's all of you guys.
That's everyone out there. Yeah. And then I'm there at the end of the line. So, you know, when all of those things have been not necessarily maxed out but optimized, then if there's a little tweak that I could offer or that needs to be done, well, I'm there for that.
Brilliant. James Southwell-Keely. I'm just looking to see if any of you have any questions before we're wrapping up. I think we've got about a few of you still watching us. Well, any questions at all about how to keep your skin toned and healthy, please shoot through. Otherwise, we're going to try to be here, aren't we, about once a month or so?
At least, yeah.
So watch this space. I think next person would be Rebecca. Was here about a month ago talking. Rebecca is the gynecologist in the clinic. Rebecca Deans.
Yeah.
Thank you. Sorry. Rebecca Deans was here last month talking about fertility issues.
It'll be Lisa for sure.
Lisa will be here next for sure. So
I think what would be great is we can come up with 100 different topics, but if someone out there, or anyone out there, or lots of people out there thought, you know what, I'd love to know about this, that and the other thing, or X, Y and Z, send those queries through or send those topics through, and we will either be able to talk to you off the top of our heads, or we'll have to go and do a little research, but hey.
Absolutely. And that you can point your queries through emails as well.
Absolutely.
Through the website. If you want to get in touch with any of us.
That always happens to me, I must admit. It's after the event I think, oh, what didn't I ask that question? So if that happens, just send an email through.
That's it. How are we doing?
Hey, we're doing all right.
I think we're okay to...
We might wrap it up. I think we've gone over time.
I think we did. Eventually, after our technical issues.
That's right. So thanks for joining us. It's been a real pleasure being at this end, and I hope
thank you, James, for all that
interesting and educational at the other end.
Quite funny.
I look forward to doing it again.
All right. Thank you very much, everyone. Bye.
Bye-bye from Bilalis Health and Beauty.
Bye.